Aloha everyone, my name is Anthony Pack and today I'm going to be talking to you about Noonan syndrome. Alright, so just a couple of objectives to get you guys started with. We're going to be going through the background of what genetic disorders are, what basically the disease is, leading to the scope of the problem, the inheritance of Noonan syndrome, a couple risk factors that have to deal with it, what genes play into it, how does it affect diverse populations, kind of going into a couple of different research studies with that, and then we're also going to be leading into the pathway that it actually affects and what happens, how it's diagnosed, support, and the major takeaways of this disease as a whole. So to get us started, a little bit of background. Genes are the building blocks of heredity, which are passed from parent to child that hold DNA, which are the instructions of making proteins. Okay, so these proteins do work in the body and the cells and building structures like tissues, organs, breaking down toxins, or maintenance jobs. However, a change in the genes can sometimes affect the body completely. This can lead to mutations, which can cause major problems or can lead to genetic disorders. These genetic disorders can be inherited from one or both parents and can happen during someone's lifetime. So now on to Noonan syndrome. So Noonan syndrome, as the ICD-10 code, is actually a congenital malformation syndrome associated with short stature, but it's not just that. And if you look to the picture on the right, you can see a wide range of facial features that are actually with this syndrome. Noonan syndrome is also referred to as a couple of different other syndromes as well. You can see here that it's Turner syndrome that is also associated with it. It breaks down into another sense and another chain within one of the pathways, which I don't really talk about in this one, but I know several of the genes which are affected in Noonan syndrome have actually been shown in Turner syndrome. So this disease affects 1 in 1,000 at 2,500 live births, and it is also an autosomal dominant manner. The inheritance rate of this disease makes it the second cause of congenital heart disease next to trisomy 21. Noonan syndrome occurs in both males and females equally and happens in the karyotype 46XX and 46XY, male, female, or, which I'll get to later down the line, is chromosome 12. So if you look to the left, this autosomal dominant inheritance pattern, you have a dad who has the condition and the mom who does not have the condition. So working gene, not working gene. And the probability that comes out of this is a 50-50 shot to be passed down. So with this, we wanted to look at and go a little bit further of these rhizopathies. All right, so rhizopathies are something that are a group-related condition that is associated with several genes, of which I said in some of the previous slides, that affect Noonan syndrome. Okay, so these rhizopathies are gene mutations within the Ras/MAZ pathway, which this pathway is very, very crucial in cell division, growth, which we know as proliferation, carrying out specific functions, differentiation, and cell movement. Also wound healing and tissue repair. So mutations in these genes from PTPN11, CRAS, SOS1, NF1, and RAF1 make the protein continuously active. And this prolongs the activation and disrupts the regulation of cell growth and division, leading to Noonan syndrome. So these genetic changes that disrupt this pathway affect the growth and development, which is also can be seen in Leopard syndrome, Sotolo syndrome, and a couple of other ones that are actually associated or a branch chain of Noonan syndrome. Because PTPN11 is actually one of the genes that is most associated with this gene, you can see 50% of the cases are actually on this gene, which is found in chromosome 12, which is on that 46XX and the 46XY, both male and female. Because PTPN11 and other genes have essential roles in this pathway, other systems can be associated with being benign or malignant. And so we have research studies that help back this up. We have hematological malignancy rates that have been shown higher in patients with Noonan syndrome compared with other cancers. The next study, which we decided to look at, was one that showed children with the disease have higher pass rates of ADHD diagnosed, as well as reduced performances compared to those with unaffected siblings and or other children. There's also increased rates with childhood leukemia and solid tumors. And then there was another one that had distinct facial features, which have been similar in non-Caucasians and Caucasian patients as well. I keep talking about this pathway, this RAS pathway that is being affected by these certain genes. So next we're going to dive into what happens in this pathway. So as you can see from this figure, it shows what's going on in the RAS pathway with specific genes that are activated for cellular growth. The path not only is used for cell division and growth, but also carrying out those specific functions as well. The genes that are used for cellular growth are affected when an individual has Noonan syndrome. So when we look at the figure, we see PTPN11, SOS1, the CRAS, the HAS, all those genes that actually affect. And PTPN1 encodes for an SH2 triazine phosphate group, which this PHP2, which actually is not shown, but it's moved on down the line, is actually a crucial cellular proliferation, migration, and differentiation process during the development stage of which makes this a key element. So in this figure, we could see those genes, which can cause the resulting protein to continuously be active. If these genes become affected/mutated, they will still bind to the receptor, causing alterations of those tissues that lead to Noonan syndrome. So these tissues that are actually affected can become some type of deformity. The general signs and symptoms of Noonan syndrome are more obvious early in life and become less obvious as the individual gets older. To identify some of these individuals who have the disorder, we have facial deformities, we have head and neck deformities, we have cardiovascular, skin deformities, skeletal deformities, neurological deformities, bleeding disorders as well. Some other signs that deal with cognitive functions. Up to 1/4 of the affected individuals have mild intellectual disabilities and language impairments. Other symptoms associated with Noonan disease with pulmonary stenosis is found in 20 to 50% of the individuals. You also have children who are 20 to 30% that are affected between birth or development in infancy for certain types of cardiomyopathy syndromes. There are a variety of skin and skeletal neurological deformities, as well as organ and bleeding disorders. So one might think that diagnosing Noonan syndrome might be a little easy, because we already know the signs and symptoms. There's a lot of facial features that you could see on the external source of a body, so whether it be short stature, skeletal neck, or some type of other facial deformities of which you can clearly see. However, it can be a challenging process to diagnose Noonan syndrome because those genes that affect in those growing pathways during development are crucial to understand. So that's why when diagnosing, we have to look and use genetic screenings. Rather that be a primary physician who can do genetic screenings, but a physician who sees the patient often enough to see the features to warrant the identification of Noonan syndrome can then request to screen for mutations of those genes of which I stated previously before. However, some of those features are actually still shown in genetic diseases that are distinct syndromes with partially overlapping phenotypes, which I stated in one of the previous slides through ICD-10 diagnosis that are categorized Noonan syndrome with similar diseases like Turner syndrome. So this can actually make it really difficult for physicians to diagnose Noonan syndrome. One of the studies that was actually shown actually used obstetric ultrasounds and fetal echocardiographs to help with the main diagnosis methods. So they ended up using DNA from blood, veal amniotic fluid, which can be analyzed for mutations. And it's actually strongly recommended for patients with signs of Noonan syndrome in their fetus or their family members with the disease. The study then goes on to suggest different types of next generation sequencing because it's faster, more accurate, more cost effective to diagnose these rasopaths than any other sequencings. Many of the websites actually on physician pages, on other organizations, government agencies actually have guidelines for research and management of the disease, which is actually very helpful for when you have a daughter, a son with Noonan syndrome, or you found out earlier on that you are actually a carrier of the disease. Unfortunately, according to the Cleveland Clinic, there is currently no way to prevent Noonan syndrome because it is a genetic mutation that is inherited from both parents or can occur spontaneously, which can cause the disease. However, there is some good news for Noonan syndrome patients. The majority of children that have been diagnosed with the disease can and will function normally into adulthood, but they will need special care and counseling. So within the public health field, within the healthcare industry and whatnot, there's actually a lot of public health support, a lot of physician support, government organization support, whether that be with guidelines, research, management, links that can help you, help your families, help you understand, gather more knowledge and awareness of the disease. So there's a lot of helpful sites out there for you if you're looking to understand Noonan syndrome a little bit better, or if you have a loved one that's actually diagnosed with it. There are still gaps with this disease. So some of the gaps include molecular and genetic causes, which have yet to be answered. Most of the risk factors that we have seen are either inherited from a parent who's affected or a random mutation that occurs in children without genetic predisposition. However, some genes or mutations are responsible for 15 to 30% of cases that have yet to be identified within Noonan syndrome. So there is still some room to grow in the coming years of the new research and identification of genes that will play to diagnose this disease. One thing that I believe the public health workers and physicians should start doing would be addressing the disease prevention with blood screening. So rather than be you going and getting normal blood work done, there's actually an additional step to see if you are a carrier of the disease on your typical normal blood work. Instead of going and getting a specialized super test that might cost thousands and thousands of dollars, it would just be on a typical normal blood screening that you could just go to your physician and get probably a prescription write-off for, which can definitely help parents and future parents know how to accommodate their child or help their child later on in life who has the disease. So there are many interventions currently for early detection management for symptoms that many research papers, information centers, and other organizations have started to have most of those people with the disease can reach adulthood. So it's actually in a good realm right now for the knowledge, for case management and whatnot of what actually Noonan syndrome is. I just think there might be, an additional step, especially with those molecular and genetic causes that still pose challenges. So in regards to the next steps for Noonan syndrome, there is continuous research that has been happening currently or in the past, but there's continuous efforts from organizations / other research facilities. The Noonan Syndrome Awareness Association, as you can see on the right, people are continuously trying to get this underhand, trying to get awareness out, trying to see what's happening within the cells, within these genes, within these pathways to help people down the line understand what's going on better. Whether it be looking at diverse populations, seeing who is affected more in either race, ethnicity, geographically as well. Also in 2016, I know that was almost 2+ years ago, but one of them actually looked at a different gene, which was A2ML1 gene expression, which actually became related more to Noonan syndrome. So there's continuous education, continuous expanding of resources. I definitely feel like with the knowledge of continuous research, trying to help as much people as possible get educated, and definitely trying to expand the resources for those populations that could be affected more, be able to obtain those resources that they need to help live with this disease for longer, with that continuous support from physicians as well. Lastly, we have to look at the takeaways of what Noonan syndrome is. So we understand that this disease actually affects a major pathway that leads to many different disorders. We have a variety of conditions, deformities that play a role in this. So it's not just facial features and skin, it's also cardiovascular problems, it's also cognitive problems, Different things play a different role within this disease that are affected by certain genes. So those genes play a role as well. We understand that it is the second cause of congenital heart disease. Even though we have all these problems, the good news is that patients can actually live normally who have the disease. We just have to understand that physicians should be aware of the complexity of disorder. We understand that it takes a while to potentially have this genetic disorder diagnosed because of those genetic screenings and those genes playing a different role. But we also know that these patients who understand that they have it and can live a normal life need to have continuous watch from a physician, from a public health care worker, that can be able to give them the resources, be able to give them the knowledge, be able to give them the continuous care for them to live a peaceful, normal life, but understand that Noonan syndrome is not all bad because that is who they are. Last takeaway that we want to understand is that there's continuous research and there's also support that's happening within the community of Noonan syndrome. So that's my takeaways. That is my understanding of what the disease actually is, and I hope you liked my presentation of Noonan syndrome. Mahalo.